Looking for financial insights you can trust?
How do you protect yourself as an investor? What's the strategy?
I think it's really simple. I think you just want to be diversified in your portfolio.
The Payne family brings real-world experience to every conversation.
Well, I think that's the problem right now is, right, a lot of people that are close to retirement, they're taking so much risks. And if we do get a big sell-off, it could derail their retirement.
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.
Sunday morning. Live long and prosper. With us today again is Dr. Peter Michalos. And, a lot of our, you know why WABC is number one? A lot of our listeners are living longer because of all the tips we're giving them how to live longer. Well, what's our tips for this week, Dr. Peter?
Well, John, this week we're going to talk about a very important topic that affects so many people in this country and around the world, and that's cancer. And cancer is fundamentally an age-related disease for most humans, as aging cells accumulate more damage as time passes. Just like we know that skin cancer is cumulative exposure to ultraviolet light over a lifetime, and you get more melanomas, basal cells, and squamous cells. But current research is suggesting that 50% of cancer could be prevented if we optimize our lifestyles, our diet, our gut microbiome, which of course we know is of our immunity, and our environment by being in fresh air and having access to clean water. And we have to look at cancer, for example, as trying to keep our body optimized. Our car, when it's running well, for example, we drive down the road, we look at the dashboard on our car, pull our levels on our gauges in the normal range, and our car performs better. And that's how we have to look at our bodies. When all our blood tests, which we call our biomarkers, are in the normal range, for example, our sugar, our lipids, our uric acid, our inflammatory markers, our thyroid hormones, our heavy metals, our sex hormones, our vitamin D, B levels, guess what? Look, we feel better, and we also get less cancer when we're functioning optimally. Now, there are a lot of tests now to diagnose cancer, which again is these abnormally dividing cells. And some of them are the CEA, for example, is a blood test for colon cancer. The good old-fashioned CBC complete blood count sometimes picks up leukemias, abnormal white blood cell growth, or other cells in our hemoglobin. And then we have the CA-125, which is a marker for ovarian cancer. There's a CA-19-9 for pancreatic cancer. There's even a HCG blood test, which can tell you about ovarian and testicular cancer. And there's even an alpha-fetal protein marker for people who have liver cancer to diagnose it and even to follow progression. So when you get treatment, you see if the marker comes, you know the cancer is getting better. Of course, the screening tools for everybody that we encourage are the Pap smear test women by Dr. Papanikolaou that millions of women from cervical cancer, the PSA test, of course, very important for men to follow, which is the prostate-specific antigen to check for prostate cancer. And, of course, we have colonoscopies. And for those who are afraid of colonoscopies, there's even a test called Cologuard. You can just analyze, send off a sample of your poop, and it can find the DNA of cancer cells, and it can show up even before it starts. If it's positive, then you go get a colonoscopy. And if you have a polyp or something that has to be removed, you can end up saving your life. And, of course, for women, mammograms are important. And even men need to do breast exams because breast cancer does exist in men, and it is rising. And for women with dense or fibrous breasts, they even have breast MRIs that can look at more details. Now, how do we prevent cancer?
Well, Doctor, we all talk about cancer. It's like a Xerox, a common word. Are there different types of cancers depending? I mean, how many different kinds of cancers are there? What is the definition of cancer?
Well, basically, it can be any cell in the body that decides to, instead of...
Every week, the Payne family cuts straight to the real financial story.
The one question, Bob, everyone's asking is, are we in an artificial intelligence bubble? You've been through boom and bust. What do you think?
No hype, no myths. just what actually matters to your money.
Does feel very similar to what we experienced in the 90s. Where are we, though? Are we in 1995, 1997, 1999?
Listen to the pain points of wealth on the Red Apple Podcast Network.
This National Foster Care Month, Marine Toys for Tots is providing hope to children who need it most. Staff Sergeant James Caldwell, who grew up in foster care himself, shares that while handing out gifts at a Toys for Tots distribution event, a little girl looked up at him, reached into her bag, pulled out a stuffed animal and said, "Someone needs to make sure you get a toy too." That simple gesture embodies the heart of Marine Toys for Tots, ensuring every child, including those in foster care, experiences the kindness that can transform their future. Visit toysfortots.org today.
Eczema is unpredictable, but you can flare less with Ebglyss, a once-monthly treatment for moderate to severe eczema. After an initial 4-month or longer dosing phase, about 4 in 10 people taking Ebglyss achieved itch relief and clear or almost clear skin at 16 weeks. And most of those people maintain skin that's still more clear at 1 year with monthly dosing.
Ebglyss, lebrikizumab LBKZ, a 250 milligram per 2 milliliter injection, is a prescription medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds or 40 kilograms with moderate to severe eczema, also called atopic dermatitis, that is not well controlled with prescription therapies used on the skin or topicals, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. Don't use if you're allergic to Ebglyss. Allergic reactions can occur that can be severe. Eye problems can occur. Tell your doctor if you have new or worsening eye problems. You should not receive a live vaccine when treated with Ebglyss. Before starting Ebglyss, tell your doctor if you have a parasitic infection.
Ask your doctor about Ebglyss and visit ebglyss.lilly.com or call 1-800-LILY-RX or 1-800-545-5979.
When you want your spring break to feel like... and your kids' pool day to feel like... and your hotel bed to feel like... ooh, and room service to feel like... Because at Hilton, hospitality feels like...
Your cabana's ready. Would you like fresh towels?
It matters where you stay. Book now at Hilton.com. Hilton, for the stay.
Multiplying normally, it starts multiplying rapidly, and what I call boundary violations. For example, your finger knows to stop growing at a certain length. Your ear knows to stop growing. A cancer cell loses that and becomes uninhibited and starts growing beyond where it's supposed to be within its area or range or type of tissue. And what happens is that when we have high insulin levels and high blood sugar levels, these are growth signals that encourage these dormant cancer cells to divide. We have a surveillance system called the T killer cells that go around, and whenever there's an abnormal cell, we try to stop it. So it can be any part of the body, ovary, colon, brain. But if it starts growing rapidly, and then when it starts growing, it says, "Get out of my way, I want to survive," it starts healing blood vessels, and more blood vessels go around to feed it. And that's what happens. And it's also associated with inflammation. So throughout the body, it affects all the cells. When you have chronic low-grade inflammation from pure diet, stress, damage from DNA, that fuels cancer. And how do we slow it down? We have to cut off its food supply, and that's why fasting helps control cancer. They studied this, and they put people on water fasts for a week, and solid tumors actually shrunk. They thought those people were quacks, but now it's been proven that if you do fasting, you can help control the speed and growth of cancer.
Especially staying away from glucose and sugar, which feeds the cancers.
Yeah, no, absolutely. And now we have new technologies like vaccines. You can take a sample of your personalized tumor and make a vaccine that attacks the surface proteins on that specific cancer. And now there's even immune therapies that can basically attack specific cancers. But, of course, in the end, if you have a solid tumor and it hasn't metastasized, good old, when in doubt, take it out. And people can survive if you catch the tumor early. Just like colon cancer is very curable when caught early before it metastasizes. And cancer cells want to spread and live, and just like viruses spread and live, they want to go to different parts of the body. But again, all these different things, we have to try to reduce it by eating more plants, Mediterranean diet, reducing processed meat. We talked about the sugar. Don't eat like burnt bacon, burnt steaks. People who do all this well-done stuff, all that black stuff is called nitrosamines, and it's known to increase the risk of cancer, and of course, reduce the refined sugars like we talked about. And these are all things you can do. I know the blood tests are like
and also all the chemicals we put into our bodies versus eating pure food that our Creator created for us.
Right, but the bottom line, you got to catch it early to treat it. There's even a company on Long Island that has the patents built a machine that analyzes your breath with chromatography. You blow into it, and they claim that they have found that they can diagnose over 90% of colon cancers. They can diagnose sepsis early and even spot lung cancer just by breathing into a machine. And they could even spot COVID instead of shoving that thing up your nose, the swab. Now you can just breathe into it and it can pick up COVID. So that's an exciting new technology that we're going to be hearing a lot. It's called the breath scan by a company called Rua, and they're going to be analyzing breath analysis and other tests like the blood test, the Galway test, which can spot 50 cancers before they start. It's an exciting time that we can catch things early. So I encourage people, if they don't feel right, go to your doctors. Now it's the new year. Get your annual physical and get checked out. Because when you catch things early, you can live longer. And if you keep listening to WABC, you'll get more good ideas on how to live long and prosper.
Thank you so much, Dr. Michalos, and may our listeners listening to us at WABC live a long time. Thank you so much.
And thank you and Margaret for giving us the microphone to get the truth out on the Cats Roundtable.
Listen to this podcast now
on the Red Apple Podcast Network. The Idea Gen Global Podcast with George Sifakis.
I'm George Sifakis. In a world overflowing with noise, there is one forum where the world's smartest voices connect, where visionaries sit at the same table as innovators, and great minds don't just talk, they act.
Download all of Red Apple Media's podcasts right now through your favorite podcast platform.